People have ruined it with medical conditions that doctors don't believe you about. What's your story? Serious. I had giardia in college. Went to the nurse on campus. She gave me a condescending talk about trying Imodium first before I bothered the all-important student health with something like diarrhea. I was crapping blood and mucus. And yes, I told her this. I then called my parents after the double doses of Imodium didn't work and they came and took me to the local hospital. I crap in a cup for the doc at the hospital and he came back and said I was dehydrated but fine. I had filled the cup with mostly blood and mucus. At this point my dad said something along the lines of, "You must be fine because 2 medical professionals said so." I cried and begged my mother to believe me, and she took me to a G specialist in a larger city, who had me crap in a cup again. At this point I was emaciated and crapping my brains out if I took even a sip of water. He gave me Flagyl and I lived to tell about it. Giardia is rough. I've had it twice. Didn't get it treated for a few months the first time round and as a result still can't quite handle dairy properly 2 years on. In an unrelated event one of my mates got it from accidentally spraying baboon crap into her mouth. So at least it wasn't that. For 6 years I got occasional headaches really bad behind one eye socket. It would happen every 4-6 weeks and unbearable headache would last 3-4 days solid. No Tylenol or meds worked. Told doctor it felt so painful it felt like it would feel better if I jammed a pipe through my eye socket for relief. We tracked my cycle. I went off Nuvering. Tracked headaches on a calendar. She thought it could be dehydration or related to the weather, sinus. Nothing was a pattern. Year later, got a script from my primary doctor that if I took the injection at the very beginning of a headache it would go away for good. But if I wasn't able to take it right away, like an hour later, the shot didn't work at all. I thought I had a sinus infection. Went to in the town I worked. He treated me like a druggie and he inspected my toes for needle marks. Because I came in and had mentioned that I thought it could be a cluster headache. He was a very old man and said I was telling him I had exactly all of the symptoms to a T of a cluster headache and most people don't have all of them. By his reasoning I was making it up. Yes, I had done many WebMD searches trying to figure out any and all things it could be. The eye doctor did a picture thing to look at back of my eye. All was fine. So no tumor. Had an MRI and CAT scan. They came back fine. The neurologist just extended my script saying that as long as those meds work to keep it up. But I didn't want to manage it. I wanted to find a cure. Went back to eye doctor a year later. Still nothing found. Finally got my primary doctor to write me a referral for blood work. Ended up that it was my thyroid issue. Been on meds for over a year and a half and haven't had a headache in that entire time. So thankful to know what it actually was. For a long time it was a running joke with my husband that I was going to die young and I told family to perform autopsy that they would see I had a cantaloupe-sized tumor behind my eye. Glad that's not the case though, but seriously took a long time to figure out. Some doctors, not all, don't believe I'm allergic to Benadryl since it's an antihistamine. It's about 60/40 believe me to don't believe me. My throat closed when I took it for allergies once. Yes. I've been to an allergist who confirmed it for me. It's way more controversial than I would have ever thought, especially to pediatricians when I disclose that I'm allergic for my son's records. Anyone can be allergic to anything, including Benadryl. However, such allergies, especially if you have numerous allergies to meds foods, may actually be an involuntary psychogenic, functional response. Lots of research is looking at this since we are encountering more and more people with unusual or numerous true allergic responses. For months I had trouble eating and was losing weight, which as an already skinny guy was a problem. During this time anytime I ate it felt like the food was catching in my throat and I eventually had to throw it back up. This led to me being sent through multiple doctors who all took blood samples and sent me to a psychiatrist to treat my food bulimia or other eating disorders. So for months I slowly starved while trying to explain to doctors that I do in fact want to eat, it's just impossible for me. Finally, they sent me to do a barium swallow just to prove to me I'm perfectly capable of eating. This is where they finally found out I had a very severe case of the rare disorder achalasia. This is a disorder where the muscles in your lower esophagus spasm uncontrollably, making it difficult to swallow. It's also a very rare disorder that is exceptionally rare in people under 20. I was 15. Eventually, after a few more weeks on a liquid diet, I had a surgery to resolve the issue and I was able to eat again. However, it was a very annoying and painful process to get to that point. I'm sorry they didn't take that seriously. This entire thread is making me so infuriated. Aquagenic pruritus. It affects me every day. Some days are worse than others. I worked with a doctor for about a year on trying to find a cause. In the end, he concluded with me water was the only common factor in my outbursts of extreme itching. Laughed as he left the room. That's the last time I saw him. I went home and Google searched my symptoms. Saw a forum for people who had identical issues. Tried their methods and it has really helped. I've been having gallbladder attacks for months now. I mean, it felt like death was knocking on my door and I was gonna. Apparently it couldn't be my gallbladder because it didn't hurt the right way and there were no stones. Guess who has a diseased gallbladder? Only found out after I absolutely insisted they do more testing. I was in pain for 10 years before they finally did an ultrasound and saw stones. They said I was too young. I had a stone the size of a chicken egg wedged in a 10mm duct and my gallbladder was dying from lack of blood flow because the stones cut off circulation. I asked 6 doctors to check my gallbladder before one finally did once I was old enough. When I was about the 3rd grade, I was adamant that I needed glasses. It was hard to see, but when I went to the doctor, for some reason they assumed I wanted glasses because all the smart girls in school had them. Partially true, but I could not see. Fast forward a few years and I'm 15 trying to get my learner's permit for driver's ed. They tell me I can't start driving until I see a doctor about my eyes. I go and I get seen. They tell me I have a fairly severe case of refractive amblyopia. I'm blind in my left eye, to all but colors and very vague shapes. My doctor tells me if I had caught it before I was around 10, I could have participated in therapy to reverse the damage to my eyes and the optic nerves. Because I hadn't, it's irreversible. No surgery, no corrective lenses. That's just my lot in life. I didn't have any trouble in school like kids with undiagnosed vision problems do. My eyes track correctly. There's no physical indicator I cannot see. So no one ever thought anything of my complaints and eventually I stopped complaining. It doesn't hurt me, but I have no depth perception, and it was disappointing to hear it can't be fixed. Interstitial cystitis. It's a painful bladder condition that is poorly researched and not well known about. How I explain it is, when it flares up, it feels like I have a bladder infection, burning, peeing lava, feeling like there's a rubber band around my bladder, all that, but I can't take antibiotics because there's no infection to clear up. And the prescription medications for it are really iffy, so I just have to wait it out. Anyway, I went to the doctor for 5 years who kept telling me I don't know what's wrong with you. Drink more water. Then I finally got a diagnosis from another doctor. Then it flared up really badly, so I went to visit another doctor who refused to believe the diagnosis and made me do STI tests, which I had already done about 10 times, as well as a pelvic exam. Extremely painful when I'm in a flare. And then told me I probably have pelvic inflammatory disease from an untreated STI. I said I've been in a relationship for 7 years. I've never had another partner. I don't have an STI, and he said something about how that doesn't matter. So I spent a week internally freaking out that my so cheated on me. Then they called back and said my results were totally clean. Now I don't even bother going to the doctor when I have a flare up. I've had a doctor lecture me about having PTSD for sexual assault because it's a choice to put yourself in those situations. Military are the only ones with legit PTSD according to this doctor. He was seeing me for a severe panic attack I had. I hope you filed a complaint about him. That's horrible. When I was 14 I woke up paralyzed, was screaming my head off freaking out. Parents took me to her a few hours later when they realized I wasn't faking it. Doctors put me in mental ward, saying there's no physical reason she can't move, so she just believes she can't move. They finally do an MRI. I have epilepsy. It was a seizure type called Todd's paralysis. where you have a seizure in your sleep, and your brain and body lose connection for a period of time. Vaginismus. It's where your pelvic floor muscles contract involuntarily when you try to insert something like a tampon, a penis, vibrator, or in this case a speculum. Most gynos are not understanding of it, even if you're having a panic attack on the table. Not one doctor could explain to me what was going on, so I just believed, for many years, that I was either mentally weak or physically fricked up. Throughout puberty I cried and screamed from the pain in my sternum. It felt as though something was pulling it back from inside and I had a stabbing pain throughout my sternum. As a kid, my sternum was normal and perfectly fine, but it caved in during puberty. Along with this, several of my ribs got all fricked up and started taking on weird curves and dents. I went to several male doctors as a kid and they all said the pain was in my head and that my ribs and sternum must have always been like this. I begged my mother to take me to a female doctor because old male doctors were horrible about telling females everything was in their head. She never did and I never found out WTF my body was doing. Now I have pectus excavatum and some fricked up shaped ribs. My doctor flat out refused to believe I could have endometriosis because I was only 19. She gave every excuse from you have gas to it's in your mind. Then my appendix was bursting a few months later and when they pulled it out it was covered in endometrial adhesions. I had to have 2 laparoscopic surgeries to remove all the adhesions that had begun to cover all of my insides. Lipedema. I have always been the chubby girl and then the fat girl since high school. About 4 years ago, I find out I have lupus. I go to my rheumatologist who looks at me for a few minutes and says, "Your knees? Where are your knees?" I think to myself, what, you have not seen fat people knees before? I leave, but her comment haunted me. One night last year I started googling fat people knees and the word lipedema came up. I immediately started crying. These were my people. I finally felt like I found my truth. Not lying. Lipedema is a fat disorder where your body doesn't store fat correctly. Therefore, no diet or exercise will remove the fat because the body doesn't recognize it correctly. It starts during puberty and increases during other hormonal times. Its other name is painful fat syndrome, which explains why sometimes even a blanket on my lap hurt. This explains why 1200 calorie diets never worked. Gastric bypass didn't work. Still, my it didn't believe me. I had to sit one down with over 300 pages of documentation before he understood. Very few doctors have heard of it and even less treat it. I had to drive 2 hours to a lymphatic specialist. He looked at me and immediately diagnosed me with lipedema. Since then I have had 2 very large liposuctions to remove the diseased tissue. I will have to wear compression garments to prevent regrowth, but at least I know what is wrong with me now. If you Google it, it is lipedema and not lymphedema. People always get them mixed up. Thank you for this. I've always been fat, but my calves have always been abnormally huge to the point where doctors are concerned, but they just poke at my legs and move on. They look just like the lipedema pics. I'm going to go see my doc about this. You may have just saved my life, so thank you. Not sure if it would be considered a medical condition, but when I get nervous, really upset, any kind of excited emotion really, I'll get these super red blotchy type marks on my chest. If it's extreme, they'll appear on my neck, shoulders, and even the side of my face. They're not bumpy or itchy, so I don't think they're hives. Just these really oddly shaped red splotches. I've gone to a few doctors for it, but they had no clue what caused it. Just told me to take Benadryl and live with it. Benadryl doesn't help. This might be blood vessel dilation from being nervous. Pretty normal. Similar to blotches some people get from alcohol. This was when I was a kid. I had what my parents called growing pains. Basically my legs would ache at night to the point I was screaming in pain. Happened from about 7-10 almost every night. I know it wasn't imagined as I remember the pain to this day. My parents took me to the doctor multiple times, small town, one doctor, and each time he sent me home with growing pains and real. But now what really fricks me off is I don't care of the term we used for it wasn't a thing. I was in agony for 3 years and he simply sent me away. It stopped happening eventually and never knew what caused it in the first place. I was always told it was from not getting enough calcium fast enough. When I was younger my parents gave me a glass of milk when it happened, which seemed to help. Being diagnosed with interstitial cystitis as a teenager. I was in incredible pain and found no diagnoses until the third urologist, a specialist in women's urology and specifically IC, diagnosed it via cystoscopy. I think it may be improving. Last time I was at urgent care, on vacation, the physician looked at my urine results, a decent amount of protein, even more blood, but not infection, and said, "This looks like IC urine." I had the same experience, DX'd in 2006 at 18. Back then no one knew what it was and accused me of lying about being sexually active. Now I tell a doc I have it, and they nod and sympathize. Thank gods I'm mostly in remission now. Mine was severe back pain. I'm 41 male, and have thrown my back out 50-60 times since I was in my early 20s. No big deal, right? Just hobble around for a few days and it usually would just slip back in on its own eventually. This went on for years until about 3 years ago I threw it out and it didn't get better after a week. Then 2 weeks. Then 3 weeks. I was working construction the whole time. Finally it got to the point where I just couldn't function or take the pain anymore. So I went to the doctor. Take it easy, wear a brace etc and sent me on my way. That lasted another week until I finally drove to the ER at 3 AM. I told them what was up and insisted on a MRI CT scan. Those suckers were dead set on giving me an aspirin and sending me home with a pat on the head. The dumb luck of what happened next is the only reason I believe I'm actually okay now. They were going to give me a shot of something. Can't remember what, but it wasn't a painkiller. And I told them that once in a while when I get a shot, I will get a bit queasy, lightheaded. Okay, no biggie. Well, I couldn't really lay down because it just hurt too dang much. So I was sitting in the hospital room when she gave me the shot. Then she immediately left the room and I was alone. Sure enough, I started getting a sick feeling. So I stood up to go get ready to puke into the trash can. And I proceeded to pass out cold and fall to the floor, hitting my head on the tile floor so hard it broke my nose and gave me a gash that required quite a few stitches. Well, I woke up surrounded by hospital staff being gurneyed to, you guessed it, MRI, because I fell in the hospital, lawsuits and all that crap. Well, long story short, I had 3 absolutely destroyed discs, one which was shattered in pieces poking into my spinal cord. Big surgery less than a week later, and feeling great now. All because I'm a little bee that can't handle needles. Listen to that. The doctors would only give this person the MRI he needed when it was their neck on the line. Isn't that freaking typical? Chronic migraines. I have a migraine every day, but about once a year since I was 12 I have one so bad I have to be hospitalized. The last time I went, a doctor pulled my mother into the hall and not so quietly accused me of faking it for meds. After trying 3 or 4 meds and my head consistently getting worse, he came back and told me he was giving me the strongest meds the hospital could provide me, and within 20 minutes my nose started bleeding and I was screaming from the pain. He told me he had given me a placebo the last time, and I had to be hospitalized in a quarantine room for 3 days. Quietest room they had available. No clue what's wrong with me still. I was a sickly kid. I was underweight and I'd catch whatever bug was coming around. Headaches, body pain, sensitivities, bathroom issues. Test results were always just barely within the boundaries of normal, but if somebody had put all the pieces together I could have gotten help. My mom called me a hypochondriac. I remember being about 13 and crying at the doctor, asking what was wrong with me. I told him I eat healthy and exercise. Why do I feel so bad all the time? He told me to put on weight, believed my mom that I was making it all up, told me to eat a Twinkie. Turns out I have celiac disease. I was malnourished all my life because my body wasn't absorbing the nutrients in my food. For me it didn't show up in regular blood work. It wasn't found until I was 26 and got an endoscopy looking for ulcers. My daughter has it too. So does a cousin. There are better tests now, thankfully, so hopefully nobody else goes through what I did. I spent over 3 years being treated and tested for chronic leg pain. Had every kind of scan available, physical therapy, testing for nerve disorders, etc. They couldn't find a reason for why I was in indescribable agony all the time, even when I didn't walk. And when I did walk, my kneecaps would dislocate. No one believed me when I said the physiotherapy was making it worse, because it's supposed to hurt. Finally I end up sobbing in the head hostess office, telling him I just want to die. The pain is too much. Just amputate my dang legs above the knee or I'm going to kill myself. A new doctor stopped by to see what the commotion was, and after looking over my file, he had me lie on my front on the couch and drew some lines on the soles of my feet with a marker pen and a protractor. And that's how we discovered I had rotated tibias, nearly 30 degrees. It's usually only seen in people who have had breaks which haven't healed right, which I hadn't, or in a small children, where it is fixed with a soft leg brace because the bones are still malleable. There have been only like 4 adult cases like mine in the last 5 decades at my local hospital. Basically, while the ends of my tibia were still growing, the center part of my bone started to rotate, meaning all of the attachment points for muscles, ligaments and tendons were all being pulled sideways as the bone slowly rotated. Because it was so slow, there was no sign of inflammation or scarring, so although the physiology of my leg looked a little skewed, it still looked in the normal range. Obviously as I got older the blend hardened and I was then stuck with twisted tibias. So imagine someone grabbing your shin bone and twisting it 30 degrees and having everyone tell you everything is fine. The physiotherapy was actually making it worse and I ended up with some overlong ligaments and nerve damage caused by continuing the treatment while my condition wasn't known. One leg has since been fixed but it will never be normal. I essentially got my wish and had it amputated. They cut through the tibia and reattached in the correct position, waiting for the opportunity to have my second done. So thank you Mr. Protractor Doctor, you literally saved me from a lifetime of suffering. And also, I'm really sorry for all the things I said under anesthetic. You are really handsome and I was very happy to finally be getting fixed. I have a diagnosis and my regular doctors are wonderful and supportive, but I have an inflammatory skin condition that leaves me with constant, painful, boils and abscess. Every few years, I have one that gets infected and I have to go to the ER to get it lanced. It's painfully and psychologically traumatic every time. Maybe 4 years ago, I'd had a fever for a week. This is always a sign that the infection has gotten out of control and I need IV antibiotics. I go to the ER, explain the situation to the triage nurse. Of course my fever has finally broken as soon as I speak to her, but fine. She admits me and I wait. My name is called. I explain to the doctor. He rolls his eyes and tells me it's called the flu. But fine. Let's take some blood. Oh, the nurse mentioned you had something with your skin. Let me see. I uncomfortably pull down my pants and show the doctor my skin. He proceeds to tell me to stop shaving. I very clearly cannot, and do not shave, because those are just ingrown hairs. I very politely tell him that no, actually, I have this skin condition called HS. Those are boils and I need a particularly bad one lanced. He proceeds to again roll his eyes and tell me I'm wrong, belittle me, etc. I walked out. I got my IV antibiotics from my dermatologist who was horrified. Thanks for almost killing me of sepsis, ignorant misogynistic doctor. Pain relievers that supposedly have really strong side effects like being knocked out almost immediately will work maybe once or twice. Then the rest of the prescription the side effects will hardly work. The pain relief does thankfully. When I had a tooth pulled I got some pills that my mom said would frick me up and how lucky I was. I just got really tired after the first pill. The second, not so much. Then I didn't feel much side effects anymore. When I explain my high tolerance to doctors I feel like they think I'm drug seeking. Same when lidocaine is wearing off within 30 minutes and I ask for laughing gas instead. Don't ever tell a healthcare provider you have a high tolerance to pain meds, even if it's true. In general we are not prescribing as freely as we once did. And those types of statements make you that ultra high risk patient that we fear will either abuse or overdose unintentionally. Right or wrong, this is pretty much reality in the post-addiction world. This isn't a current condition and prepare yourself for a semi-long story. I was having serious back pain so I went to the ER at like midnight after getting fed up for months. They told me my gallbladder needed removal but it wasn't urgent. I could do it that week or in 2 weeks. I wanted it over with but I had to defend my master's thesis in 2 days so I said I'll just live with the pain and put it off. So I defended my thesis. My back still killing me. That weekend the pain got worse but I said I'd wait. As I was teaching on Monday morning, I was at A. The pain all of a sudden got close to excruciating. By some coincidence I had a scheduled checkup that day, so I called in pain and asked if I could come in early. They said sure and I rushed to the hospital. The doctor saw me. I told him my pain was a 10. I could barely drive and I felt like a 1,000 knives were stabbing me from the inside. He refused to take me seriously. He told me he wouldn't admit me to the hospital since hospitals are full of germs. Instead he'd move up my surgery date to the next day. He told me go around and get stuff done for it. Drive home and come back in the morning. I stubbornly did the things they needed. Blood work, etc. I was near dying the whole time but no one would listen to me. I finished the list of tasks and couldn't take it anymore. I ran back up to the doctor's office and in tears of pain I begged the nurse to let him see me again. He saw me again but still didn't believe me. My tears of utter pain, and I was a young healthy male, weren't enough for him, but eventually he decided they'd see if I could be admitted. But something went wrong. I don't know where. I told the nurse I needed to be rushed to the ER. The doctor then supported that decision instead. This poor older lady wheeled me down to the ER because at that point I couldn't really walk. She waited with me for a half hour as they found me space on a gurney in a hallway. She was my guardian angel that day. I later sent her flowers. The nurse pumped me with morphine. It didn't do anything, so he pumped me with Dilaudid. That stopped most of the pain except the pain in the gallbladder itself. After 7 hours I was admitted to the hospital. I lived off that painkiller like a drug addict all night. I had my surgery as scheduled the next day. I later found out my gallbladder had ruptured and was eating at my liver. I was at risk of going septic. My doctor admitted in a haughty way that he did not know it ruptured. Anyway, all is fine now and I recovered fairly quickly. It was an ordeal I would like to never repeat. I still thank that nurse for being the only person who actually listened to me. I'm glad you're better, friend. Pain is no fun, regardless of the severity, excluding kinks. I don't judge. A severe nickel allergy. It was horrific. Went on for about 8 months. Had nosebleeds I couldn't stop. Dry, cracked and itchy eyelids and under eyes that would turn a browny red and occasionally bleed. Skin around my hands, arms and lower half of my face was basically melting off. Unbelievable fatigue. The thought of walking to the kitchen for something to drink made me cry, haha. Had to keep working to pay for all the doctor's appointments, but whatever I was allergic to was in my workplace. I saw 5 different doctors and all they did was give me the same steroid cream to try for a few days only, and if it came back again, to go back and see them. All of them were more interested in my dew smear test and how amazing my asexuality was more than the fact I could barely see out of my sore cracked eyes. Every single doctor. One of them even told me she wished her daughter was asexual, and that it must be truly a great relief for my mother. It was humiliating. 8 months of pain, sickness and sadness. I finally found a doctor who admitted that he had no idea and referred me to a specialist. Showed him 3 photos. I had to quit my job so it had more or less cleared up, and he identified it as a severe nickel allergy. Imababa. Turns out he'd worn through the coatings of my old shears and was rubbing the bare metal all over my hands and then touching my skin with my dang hands. Now I've got a shiny new pair of A-grade shears and I'm back to normal. Sorry about those doctors making stupid butt comments about your asexuality. I had a therapist who was like, but sex is part of a relationship. Then insisted I sold Ver, let my ex-GF basically rape me. You. What a douchebag. I'm glad you figured that one out. Holy crap. When I was a child, my pediatrician knew and had proof of part of my medical conditions. Specifically rotoscoliosis that forms into deformed ribs crushing my left lung. It doesn't fully expand. She chose to not tell us. Eventually my mom started to really think twice because I always complained about my back hurting. She ended up making an appointment with a different pediatrician. He took x-rays. When we meet with him after the x-rays, he told us that he couldn't do anything, that it was out of his experience. He explained it the best he could but sent us an immediate referral to someone else. We met with the new doctor, showed him the previous x-rays. He literally laughed at us. Said there was no way these were right because I wouldn't be alive or at the very least not walking. He was so sure we were wrong he ordered his own tests, an MRI. Once we did that, he personally called us. Not his nurse or receptionist. He called us and apologized. He was in disbelief that I had so much going on and still walking around like a normal kid. Unfortunately for me, by the time it was all found out, my rotoscoliosis had gone past the point of help. This happened when I was 9 years old. I'm now 23 years old. They didn't even think I would live this long. To this day it doesn't matter what I tell the doctors, they don't believe how bad it is until they see it for themselves. I went to the ER recently and they did chest x-rays. I tried to tell them beforehand my medical conditions so they wouldn't freak out. They dismissed me. Then I'm standing there after they take the first one. I hear them saying, "Oh my god, did you see this? Look at her spine." The doctor in said, "Well, yours rays look fine other than some bad scoliosis." Awkwardly laughs because he realized he should have listened to me beforehand. I have myalgic encephalomyelitis, aka chronic fatigue syndrome, CFS. It took me over 10 years to get diagnosed, as most healthcare professionals did not take me seriously until about 3 years ago. There was a time in my life when I was completely paralyzed and unable to speak because I was literally too exhausted to open my eyes for days at a time. I was branded exclusively with mental health issues in my teens and overprescribed with Xanax, sleeping meds, and SSRIs into my 20s. It was a relief to find out a decade later that the constant flu symptoms were not all in my head. Go watch Unrest on Netflix to get an idea of the disease and the injustice surrounding it. I have been seeing an allergist asthma immunology doctor for bad seasonal allergies. On Christmas, I had my first asthma attack triggered by tobacco smoke. I started coughing and couldn't stop. Literally felt like I had a Brillo pad in my throat, bronchial tubes. I was coughing so bad I couldn't catch my breath, and everything was closed up and inflamed. Literally an hour and a half both times. Never had this before, and I grew up around smokers. Second time was residual weed smoke covered by very strong perfume. Went to the ER both times and an albuterol breathing treatment got me breathing again. My initial pulse ox was in the 70s before the treatment. My allergist did spirometry and it was normal several times. But when I was at the ER, the doctors there called it asthma. But he won't call it asthma because my lung volumes look good. What the frick else could it be? My primary gave me a pro inhaler, Symbicort, Flonase, and hardcore allergy pills. Also, a nebulizer. Haven't had an attack since February, knock on wood. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.